The next selected synovial joint that we're going to look at is the elbow joint. And the elbow joint obviously is where the humerus articulates with the radius and the ulna. It is a hinge joint. So as you should know by now, it does articulate in one axis, making it a uniaxial joint. And it's primarily where the trochlear notch, specifically of the ulna, articulates with the trochlea of the humerus. So it allows for flexion and extension only. So when we zoom in here, we can see again all of the extra features of a synovial joint. You can see here the trochlea of the humerus that's fitting in the trochlear notch of the ulna. Also, our articular cartilage, which is at the ends of these bones. There are bursa and fatty pads, articular capsule, synovial membrane, synovial cavity where there's synovial fluid, more articular cartilage, as well as some tendons. Now, the interesting thing about the synovial membrane is it starts to produce synovial fluid, and that process is called weeping lubrication. So this is one reason that it's very important for you to stretch your joints, move them around before a sport, for example. The other ligaments that are shown at the bottom here are collateral ligaments, and collateral ligaments are called extracapsular ligaments because they are found outside of the synovial capsule themselves. So we have the radiocollateral ligament and then another ligament called the annular ligament. Again, you don't need to know the names of those ligaments. The next selected synovial joint is the coxal joint, which is a ball and socket joint. And remember, it's multi-axial because it is in multiple planes. And the large spherical head of the femur articulates with the deep cupped acetabulum. So remember, it has more stability, so it's opposite of the shoulder joint, but less range of motion. So it's got a good range of motion, but it's limited by the deep socket. So great stability comes from the deep ball and socket joint, also the short ligaments that are around it. So again, we see a lot of the same things like the synovial cavity and the articular capsule, and there's various ligaments as well. The most complex synovial joint is the knee joint. It's the largest, most complex joint of the body. And it's really three joints in one, which is pretty amazing. It has a femoropatellar joint between the femur and the patella. And so it allows gliding motion. So since it's a plane joint, you know that it's non-axial. It really just allows a little bit of slipping motion. The next ones are both the lateral and the medial joints, which are modified hinge joints. So as you know, that means it is uniaxial. It can flex and extend, as well as allow for a little bit of rotation. So there is the lateral and medial joints form the tibiofemoral joint, but there's a joint on the lateral side where the lateral meniscus is, and on the medial side where the medial meniscus is. So the ligaments that are on the inside of the capsule are called intracapsular ligaments, and they are abbreviated as ACL for anterior cruciate ligament and PCL for posterior cruciate ligament. Our next slide is going to show a little bit more of the knee joint, but we're looking at a different view of it. There are capsular ligaments, but we're going to ignore the capsular, so you can just cross that out. Instead, we're going to focus on the extracapsular or the intracapsular ligaments. So you should know those. The ligaments are going to prevent hyperextension of the knee. So the extracapsular ligaments are the fibular and tibial collateral ligaments. Whenever you see collateral, that means it's outside of the joint and runs alongside it. So there's also an oblique popliteal ligament and an articulate popliteal ligament as well. But the tibial collateral ligament is more commonly referred to as the medial collateral ligament, which is the MCL. Just like the fibular collateral ligament is also referred to as the LCL. So what we see here, and remember at the distal end of each of these, at the distal end of the tibia is the medial malleolus. Remember when I told you to feel the inside of your ankle, that was your medial malleolus. And your lateral malleolus is on the outside. So when I asked you to feel the outside of your ankle, that was your lateral malleolus. We're going to look a little more closely at the intracapsular ligaments here. They reside within the capsule, but outside the synovial cavity. But since they're inside the capsule, they're intracapsular. So we have the ACL and the PCL here. And the anterior cruciate ligament is going to prevent forward slipping movement of the tibia that could cause hyperextension of the knee. So since the anterior is more forward, remember that it's forward slipping movement. The posterior cruciate ligament is attached to the posterior tibia, and it prevents backward slipping movement of the tibia as well. So we have the fibular collateral ligament, tibial collateral ligament, those are the extracapsular ligaments. So fibular collateral ligament, LCL. Tibial collateral is the MCL. And then the intracapsular ligaments are the anterior cruciate ligament and the posterior cruciate ligament. So ACL and PCL. So common knee injuries, when we consider the knee, are associated with what we call the 3 C's. The knee absorbs a great amount of vertical force, but horizontal, it's very, very vulnerable to horizontal blows. So since we're in Tampa, we think of the Tampa Lightning here. So imagine a hockey puck that is striking the hockey player from the lateral side here. And what's absorbing the force is everything on the opposite side. So it would be the collateral ligaments first, which would be the tibial collateral ligament. So when they say a player has the MCL torn, that's what they're referring to. Also, the medial meniscus could be torn. That's on the opposing side of what strikes the knee. And the cruciate ligament, which is in this case the ACL injury. So lateral blows are the worst. You know, it's very unlikely that a hockey puck is going to strike the medial side of the knee, but injuries affecting just the ACL are common in runners who change direction, twisting the ACL. But when there are bad tears, it's going to unfortunately it's unfortunately going to require surgery.